If you're over 60 and waking up in the middle of the night because your feet feel like they're burning, or you keep sensing like tiny invisible bugs are crawling on your legs, what I am about to share could truly change your life. Most doctors immediately jump to diabetes testing and prescription drugs, but there's one easy vitamin deficiency that gets missed in as many as 40% of seniors, and it may be the real reason behind your leg tingling and numbness. I'm Dr. Matthew Brooks, and today I'm revealing the vitamin that neurologists often overlook, the one that could improve your symptoms before lasting nerve damage takes hold. Stay with me because what you learn in the next 15 minutes could save you years of needless suffering. Before we begin, I'd love to know where you're watching from today and what your age is. Drop your location and age in the comments below. It helps me understand who I'm speaking to and create content that genuinely serves you. Let's grow our community together. Let me start by telling you about something I see in exam rooms across the country every single day. I hear the same concerns again and again from patients in my practice. They tell me their feet hurt so much that they can't stand the feeling of bed sheets touching them at night. Others describe sensations that sound almost impossible, like bugs biting the bottoms of their feet, even though nothing is there. These symptoms are not imagined. They're real, they're upsetting. And for many people over 60, they're the first warning sign that something serious is happening inside the body. Here's what most people don't understand. Those sensations, the burning, the tingling, the numbness, are often the first clear signs of a condition called peripheral neuropathy. Now, I know that sounds like complicated medical language, but stay with me because understanding this can change everything for you. Peripheral neuropathy is damage to the nerves that extend from your brain and spinal cord out to the rest of your body. Those nerves are like the electrical wiring in your home. They carry signals that let you sense when something is too hot, too cold, or too tight. They tell your muscles when to move. They also control things you don't even think about, like digestion and blood pressure. When those nerves are damaged, signals become distorted or get blocked completely. That's when you start feeling those miserable sensations in your feet and legs. For most people, doctors immediately suspect diabetes. And yes, diabetes is the leading cause of peripheral neuropathy worldwide. About half of all people with diabetes will develop some type of nerve damage. But here's what surprised me when I began digging into this topic. In about 1/4 of neuropathy cases, doctors can't identify an underlying cause at all. Patients get screened for diabetes. They get checked for thyroid issues. They go through a long list of expensive tests and everything comes back normal. Meanwhile, their symptoms continue and sometimes they get worse. This is where things get interesting and honestly a bit frustrating. There's one simple, low-cost blood test that often gets skipped, and it checks for something that can cause all these symptoms. I'm talking about vitamin B12. Now, before you assume this is too simple to be real, let me explain why this vitamin is so important, especially if you're over 60. Vitamin B12 is absolutely critical for nerve health. Think of it like the insulation that covers the electrical wires in your nervous system. Without enough B12, that insulation begins to wear down. Signals can't travel the way they should. That's when tingling, numbness, pain, and weakness start to show up. The alarming part is that B12 deficiency can create the exact same symptoms as diabetic neuropathy, yet it gets missed all the time. Why does that happen? Because many doctors are trained to focus on the most common causes first, which is diabetes, and they don't always check B12 unless the patient asks directly or unless other tests come back negative. Here's something that really changed my perspective. As we get older, our ability to absorb vitamin B12 drops significantly. Some estimates suggest that up to 20% of adults over 60 have low B12 levels, and many have no idea. This happens for a few reasons. First, our stomachs produce less acid as we age, and we need that acid to pull B12 out of the foods we eat. Second, many seniors take medications that reduce B12 absorption. Common drugs like metformin for diabetes, proton pump inhibitors for heartburn, and even certain antibiotics can drain B12 levels over time. Third, some people have conditions such as pernicious anemia, where their bodies can't absorb B12 properly no matter how much they take in. Let me show you how this usually plays out. You're in your 60s or 70s and you start noticing your feet feel slightly numb or tingly, especially at night. Maybe you're also noticing balance problems. You mention it to your doctor during a yearly checkup. They order a fasting blood sugar test and maybe an A1C to look for diabetes. Those results come back normal or borderline. They tell you it's probably aging, or they offer a pain medication. Months pass, sometimes even years, and your symptoms slowly become worse. What nobody tested was your B12 level. And all that time, your nerves have been gradually breaking down because they weren't getting the nutrition they urgently needed. Now, let me be very clear about something important. I'm not saying every case of leg numbness or neuropathy after 60 is caused by low B12. That would be careless and incorrect. Diabetes, autoimmune conditions, infections, certain medications, toxin exposure, and even genetics can all lead to neuropathy. What I am saying is that B12 deficiency is common, treatable, and frequently overlooked, and it deserves attention, especially for people over 60. The good news, and this really matters, is that when B12 deficiency is found early, nerve damage can often be reversed. I've watched this happen many times in my own practice. When patients come in with early symptoms and tests show low B12, supplementation can stop the decline and even reverse some of the damage. But here's the key point. If you wait too long, if the nerve damage becomes advanced and permanent, correcting B12 won't fully bring back normal nerve function. That's why early detection is so critical. So, what symptoms should you look for? Beyond the obvious numbness and tingling in the feet and legs, B12 deficiency can cause a wide range of issues you might never connect to a vitamin problem. You may feel unusually fatigued or weak. You might notice you get short of breath more easily. Some people develop a sore or swollen tongue. Others experience mood shifts, including depression or memory problems, that could be mistaken for early dementia. You may feel unsteady when walking or struggle with balance and coordination. Some people describe it as feeling like they're wearing invisible socks or gloves, even though their feet and hands are bare. Here's what makes this so difficult. These symptoms often build so slowly that you might not recognize them at first. You get used to being a little more tired. You blame balance changes on age. You don't connect the dots until one day you realize your quality of life has dropped a lot. That's why I'm so committed to spreading awareness about this. Too many seniors are suffering when a simple blood test and treatment could make a real difference. Let's talk about getting tested and what to do if your B12 level is low. First, you need to request a B12 blood test from your doctor. Don't assume it's included in routine lab work. Often it isn't unless you specifically ask. The test is simple, affordable, and covered by most insurance plans. Normal B12 levels are generally considered to be above 200 pg per ml. But here's something many people don't realize. Some experts believe levels under 400 can still trigger symptoms in certain individuals, especially neurological ones. So even if your doctor says you're technically normal, if you have symptoms and your level is on the low end of normal, it may be worth discussing treatment anyway. If your B12 is low, treatment usually involves either high-dose C's oral supplements or B12 injections. For people with absorption issues, injections are often more effective because they bypass digestion entirely. Many patients begin with weekly or monthly injections until levels recover, then move to maintenance doses. Some people must continue indefinitely, especially if they have an absorption problem that can't be corrected. The good news is B12 is water soluble, meaning your body gets rid of what it doesn't use, so it's very hard to take too much. Now let's talk prevention because it matters just as much as treatment. You can lower your risk of B12 deficiency by making sure your diet includes enough. Vitamin B12 is naturally found in animal foods like meat, poultry, fish, eggs, and dairy. If you're vegetarian or vegan, your risk is higher, and you should seriously consider fortified foods or supplements. Even if you eat animal products regularly, remember that absorption is the challenge for many seniors. That's why some experts recommend everyone over 50 take a B12 supplement as a precaution. I also want to address the elephant in the room. Some of you may be thinking, this sounds way too simple. You might doubt that something as basic as a vitamin could cause such intense symptoms. I understand that doubt. We live in a time of complex treatments and cutting-edge technology. It almost seems too easy that a single vitamin could be the answer, but that's exactly why deficiencies get missed. Doctors are trained to look for complicated problems, and sometimes the simplest cause gets overlooked. Let me explain what else can cause peripheral neuropathy, because it's important to understand the full picture. Diabetes is still the top cause, affecting about half of all people with diabetes. If you have diabetes or prediabetes, managing blood sugar is absolutely essential. High blood sugar damages nerves over time, and once that damage becomes severe, it often can't be reversed. That's why catching prediabetes early and making lifestyle changes can prevent neuropathy before it begins. Certain medications, especially chemotherapy, can damage nerves as a side effect. Some infections, including COVID-19, hepatitis, and Lyme disease, can trigger neuropathy. Autoimmune diseases like lupus and rheumatoid arthritis can attack nerves. Heavy alcohol use is toxic to nerves, especially when paired with poor nutrition. Exposure to toxins like mercury, lead, and arsenic can harm nerves. And there are rare inherited types of neuropathy that run in families. In around 25% of cases, doctors still can't identify a specific cause, but many of those patients share risks like obesity, high cholesterol, and high blood pressure. The underlying damage may resemble diabetes, even without a formal diabetes diagnosis. That's why metabolic health becomes so important as we get older. So what should you do if you're feeling numbness, tingling, or pain in your legs? First, don't ignore it. These symptoms are your body's way of warning you that something is wrong. Book an appointment with your doctor and describe your symptoms clearly. Tell them when it began, how often it happens, whether it's worsening, and how it's affecting your day-to-day life. Ask directly for a B12 level test, along with diabetes testing, thyroid screening, and any other appropriate checks. If you do have neuropathy, work with your doctor to find and address the root cause. Manage blood sugar if you have diabetes. Correct any vitamin deficiencies. Review your medications to see whether any might contribute. Make lifestyle changes such as eating better, exercising routinely, avoiding alcohol and smoking, and keeping a healthy weight. All of these support nerve health. For neuropathy in the feet specifically, build a consistent foot care routine. Inspect your feet daily for cuts, blisters, or sores. Wear shoes that fit well and feel comfortable. See a podiatrist on a regular schedule. Because neuropathy reduces sensation, you may not notice injuries that can become infected. Prevention matters. If you're dealing with neuropathy pain, work with your doctor to find the right treatment approach. Not every medication works for every person, so don't quit if the first option doesn't help. Physical therapy can strengthen balance and stability. Mental health support can help you handle chronic pain. It's okay to ask for help and to keep working until you find what truly helps you. Here's my final message for you today. Your symptoms matter. Your quality of life matters. You deserve answers and you deserve care that addresses the cause, not just hides the symptoms. Don't let anyone brush off your concerns as just getting older. Leg numbness, tingling, and pain are not normal parts of aging. They are signs that something needs attention. If you take only one thing from this video, let it be this. Ask your doctor to check your vitamin B12 level, especially if you're over 60 and having any neurological symptoms. It's a simple test that could uncover a simple solution to what may feel like a complex and frightening problem. Caught early, B12 deficiency and the nerve damage it causes can often be fully reversed. That's the result we all want. I hope this empowers you to take control of your health and have informed conversations with your healthcare providers. Remember, you understand your body better than anyone. Trust your instincts, speak up for yourself, and keep asking questions until you get the answers you need. If this video helped you, please hit the thumbs up and share it with anyone you know who might be experiencing these symptoms. Subscribe to the Dr. Matthew Brooks channel for more evidence-based health information created specifically for those of us over 60. What's been your experience with leg numbness or B12 deficiency? Have you had your levels tested? Share your story in the comments below. I read every comment, and your stories help others in our community feel less alone. Until next time, stay active, stay informed, and remember your health is your greatest wealth. This is Dr. Matthew Brooks signing off. Take care of yourself, listen to your body, and never stop being your own best health advocate.